Catherine, your own area of particular expertise, intensive care units.
Yes.
Six people in ICU a month ago, 17 now. We're seeing an average of 1 to 2 new admissions in intensive care every day. How worrying is this?
It is a worry. Now, remember, we saw 90 admissions in 1 week at the beginning of the pandemic, so these figures are considerably less than it was at the height of the initial surge in cases. And we know that as you have more viral transmissions, you will obviously have more cases, and particularly as we see more people in the older age groups contracting the virus, because they're obviously more at risk. Young people can still get this disease and can still be ill with it, but it's less common for them to require critical care admission. That said, that can still happen. But obviously, the older you get, the far more likely you are to end up in the care of critical care. So it's really important that we protect our vulnerable groups, and that includes them protecting themselves and the rest of us who are younger, protecting them by not actually encouraging viral transmission by behaving appropriately in terms of public health advice. So it is a worry, and we're keeping our eyes on the figures, obviously, and particularly as we approach winter, where we see an increase in viral illnesses generally, and where we always have a surge in admissions to critical care and always have a difficulty in the winter. So it is a worry, and we're keeping our eye on it. But to be fair to your listeners, it's not as bad as it was at the beginning, but it is a big concern. So we obviously, the HSE monitor that daily,
Yeah.
and we have a bed information system where we can actually monitor it hourly if we so choose, and we'll see people being admitted, over the course of a day. It's quite an up-to-date system.
And Catherine, just for those of us who don't work in the area, sometimes it's difficult for us to assess the figures. Is there an ICU number where that really sounds alarm bells and we really start to worry?
Well, there anybody. The thing that really starts to, you've got to remember that there's more than 17 people in critical care at this moment in time. There's 233 people in our intensive care beds around the country, of whom 17 have COVID. So we have COVID and non-COVID disease. So we have at the moment 282 adult beds available to us to actually care for all the critically ill adults in this country at the moment. Public beds. Now, I'm not talking about private beds. And we would worry if they were all occupied. At the moment, there is capacity, as I understood it yesterday, for 47 additional beds.